here we are in Skerries on an absolutely glorious Friday evening. The sun is beaming and there's a great crowd here to see the launch of the new NIFTI bus service.
O'Brien, I'm the chairperson for NIFTI. On behalf of the Board of Management of NIFTI Transport, I would like to welcome you all to today's bus launch. I would particularly like to welcome the Minister for Health, Dr. James Reilly, our newly elected Lord Mayor Kieran Dennison, Michael Lorigan, Deputy County Manager, and Jerry Murphy, COE of the NTA. Senator Darragh O'Brien, Brendan Ryan TD, Councillor Tom O'Leary and Councillor Owen O'Brien. I would also like to welcome various representatives of Fingal senior citizens who make up a significant proportion of our annual passenger numbers. Now I would like to hand you over to our General Manager, Mr. Eric Bentley, to say a few words about NIFTI culture and vision.
Hello everyone, thanks for coming. You have to forgive me if I sound a bit nervous, but I'm a married man with 2 kids, so I'm not used to people listening to me. It was Aristotle who first defined the word community as a group established by having shared values. The meaning of community goes beyond the place you live. Community is something that encompasses a group of people that support each other, each contributing their own skills and resources towards a common goal. Community spirit is defined as a group of people working together to help improve the community they live in. We are delighted to be here today at Skerries Community Centre. It's a recognised symbol of possibilities of dedication and hard work by local community members to better the services in their community, and we thank them for the use of their facility. Today's event is about community. It's about the coming together of various groups, each putting in their own contribution, whether it be resources or skills, to deliver a better standard of life for others. NIFTI are involved in the Rural Transport Programme. The role of the Rural Transport Programme is to develop, plan, organise and deliver rural and local transport services. We're also members of the Fingal Integrated Transport Working Group, which is chaired by Fingal County Council. We have set out a short-term rural and local transport strategy for the Fingal area, which would provide a foundation on which to further develop local transport coverage within the county. This strategy meets the vision and parameters set out by the Minister for Public and Community Services, Alan Kelly. We believe we're on the right track in Fingal, as evidenced by the presence here today of Jerry Murphy, of the CEO of the National Transport Authority. It's either that or we're in serious trouble. This initial strategy is set out on 2 boards I have around the room here, and we have a couple of handouts down where the tea and coffee is as well. We're keen to work with any organisation or individuals that will help us in progressing this strategy for the benefit of Fingal. And indeed your presence here today helps us progress that strategy. We're currently involved with and assist many organisations within Fingal. We're involved with the Special Needs Children Remember Us, various senior citizens organisations, the HSE, Foróga, Prosper Fingal, Fingal County Council, Fingal Tourism, Fingal Leader Partnership, Fingal Volunteer Centre, Community Gardaí, Bus Air and Dublin Bus, local schools, businesses, nursing homes and local community groups. So we're very involved with the entire county. We carry approximately 7,000 over 65s a year in the Fingal area, and we're on the target for 40,000 passengers this year. So we're quite a busy little unit with 6 buses. Our website timetable, the Bowman bus alone, has had 16,000 hits since we launched it last year. Based on the Department of Transport appraisal methods, NIFTI's Bowman bus has delivered about 40,000 in economic benefit to the county, and last year alone NIFTI delivered about $500,000 in economic benefit. I myself am from Lusk, and from experiences 20 years ago, whilst in the care of an excellent and good-looking local GP, I know the frustration of trying to get to Bowman Hospital. To use a technical transport planning term, it's a nuisance. The choices range from 2 time-consuming buses, expensive taxis, getting a lift, or high parking charges when you get there. We've been running the Bowman Hospital bus from Swords for about 12 months now, and that's purely because of the available funding. We couldn't extend it any further into the county. We're very grateful to the Minister for Health, Dr. James Reilly, for the award from the 2012 Department of Health Lottery Fund. With continuous funding cuts and increasing services due to the current economic environment, demand for services, the new bus allows us to continue our mission to deliver the vital services. In our opinion, a public community bus is the only viable and sustainable option in the current economic environment, and we have promoted the concept of one bus for all for about 2 years now, whereas everybody gets the same bus and then the costs are spread across various groups and sources. Our new bus has been specially adapted and hand-built by a local supplier. The bus was procured from Parfitt at Cloughlin at the airport there. We have an onboard GPS and fleet management system which is provided by Transpoco and Swords, and the bus was signed up and labelled by Signworks in the Knoll. Service stock are mechanical genius, I was going to say. In Westmillstown, they carry out regular vehicle and tyre safety checks on the bus to make sure it's in line with the Road Safety Authority Commercial Vehicle Road Ordinance Reform Programme. We're always keen to meet with local groups and discuss their transport needs, and we welcome any inquiries. Unfortunately, we've no excess funding at the moment, but we are good listeners and capable of imaginative transport solutions. Thank you for your time.
I'm really honoured that NIFTI have asked me to come up here to help launch the service. One of my earliest memories growing up in rural Donegal was my grandmother bringing me on the Lochswilly bus service when I was about 4 or 5, and we were only going 2 or 3 miles over to visit a friend of hers. And I think that was back in the days when every summer was like this. And since then, rural transport had a fairly sort of mixed history. And I think it was only in 2002 that the Department of Transport rolled out a rural transport scheme. It was actually launched in Fingal, in the Marine Hotel in Sutton. And that was the same year that NIFTI was set up. And over that time, I mean, NIFTI was set up obviously as a rural transport scheme, but not just as a rural transport scheme. It was set up to tackle the problem of rural isolation. And isolation is not just a rural thing, as we know. You can be fairly isolated in the middle of a housing estate in an urban area if you're living on your own and you don't know your neighbours. And it's interesting that NIFTI have extended their remit over the years to include urban areas. And I'm very impressed that in the last few years that NIFTI have been carrying 4,500 people every month, that they operate from 7 in the morning till 11 at night. And as Eric described, they provide more than just a service from A to B, that they make themselves available to so many community groups and even to schools and various clubs. I just want to say that you know, isolation is really affects people's mental health, not just mental health, but obviously their general health as well. And that's something that we have to be very conscious of. So it's not that NIFTI just operate a service from A to B, they're also providing a social service. And this year, the Minister for the Environment, Phil Hogan, has rolled out extensive reforms of local government. And we're not fully aware of what all the reforms are going to be. But some of the things that other local authorities do in other countries is that they actually provide transport. And I'd like to see in some of our local authority areas that we would be given the remit of helping to run or having an input into a rural public transport system. And one of the things I've admired about NIFTI is how flexible and adaptable they are. The fact that they're a genuine community-based organisation. What I'd really like to see is that being extended to a Fingal-wide organisation. We have huge demand in my own area, in Blanchardstown and Castleknock, for a similar service. Not just to the hospitals, but to other parts of Fingal. And there would certainly be a demand at a time like this for routes to Skerries or Brush or anywhere along the coast. But there is a need to go to the hospitals, not just Connolly Hospital, but Beaumont as well. So that's something that we'll be burning the ear of various government ministers on over the next few months. So just once again, I want to thank you for the opportunity to speak here, and I hope this marks another chapter in NIFTI's history and that the organisation goes from strength to strength from here. Thank you.
Good afternoon, everybody. It's a real pleasure for me to be here today. I want to thank Stephanie for her kind words and her great work, and Eric too. I knew Eric when he was only little. I wouldn't like to tangle with him now. I think the work being done here is fantastic, and I think it's wonderful that we're joined here today by our Mayor, Kieran Dennison, and by Deputy Brendan Ryan, and Senator O'Brien, and Councillor O'Leary. But I think it's also, important to mention that we have Liam Duffy here as the CEO of Beaumont Hospital, because he understands what this means for the people who attend his hospital. The inaccessibility from this part of North Dublin to get into Beaumont is quite difficult for people, and they're often people who aren't well, and that's why they're attending their outpatients. And something that I was involved in 20 odd years ago when I was on the health board, trying to negotiate with CIE to put in place a service for my patients who are out in Ballyball and as further out up in the Knoll, or we shouldn't call it the Knoll, people in the Knoll say Knoll, not the Knoll. But these are very isolated areas, and I did have a terrible situation where there was a woman with diabetes who had bad feet, who ended up having one of her toes removed because of having to walk such a long distance to get a bus, to get into town, to get another bus, to get back out. So this is very important for people, and it's very real, and I think it's a fantastic service, and I'm really delighted to support it. And I think that it's more initiatives like this that cross across government departments, that we stop operating in silos as we've done in the past, and start understanding how we can support the people through more cooperation ourselves. And I think more and more we're going to see that. And I know I'm the First Minister for Health to ensure that we have a principal officer covering across children for intellectual disability, autism, covering areas such as obesity as well. And I think we need to do the same now in relation to transport. We can't operate in isolation. Of course, as a Minister for Health, with a health policy, I want to see primary care centres that are of a suitable standard and size that allow for the consultants to come to the community to see the patient. And why should 30 people travel in one direction when one person can travel in the other direction? But obviously that requires centres that can accommodate those consultants and equally a volume of people, so it would vary from centre to centre as to the type of consultants that would travel. But that still remains my goal, and we're well on our way to do that. And the new groupings of hospitals, of which Liam's hospital will be one, will help us towards that as well, as we get more efficiency in our hospitals. But look, the most important people here today are the community, and I welcome all of you here from all parts, from Baldoyle and from Rushville, Skerries, Balbriggan, everywhere, and also over Kieran's side, over in Castleknock and Mulhuddard and Blanchardstown, because it is about you, and it's about us listening to you and trying to meet the needs. And we are you at the end of the day, and we're going to need the health services as we progress in years, and we want to make sure that they're suitable for purpose. So again, I want to commend the fantastic community spirit that underlies this initiative. I want to commend NIFTI, Eric and Stephanie and their team, and I know some of the members of the board like Sheila Corbally and Tony are here, and others as well. They didn't give up when times were tough, and maybe not as much cooperation coming as there might have been. But we look forward to expanding, I would think, this service. I think it's very important. Sheila was going through the red lines. They're always the dangerous ones, I'm told, that they need more funding for, and I'll certainly be supporting that in a major way through cross-government cooperation. So I just want to not delay you any much longer. Thank you all for your time and attention. Thank you all for being here in Fingal on this fine Friday afternoon. And let's enjoy the good weather we have while we have it, and I won't keep you in here any longer. Thank you all very much.
So I think there's nothing else to do now but go out and cut the ribbon.
A tree.
I'm joined now by Kieran Dennison, Mayor of Fingal. Mayor Dennison, what do you make of today's launch?
Well, I think it's another chapter in the history of NIFTI and the development of NIFTI as a rural transport company. And if you think of it, NIFTI's only going for, 11 years now. And I think it provides a fantastic service for rural Fingal, rural North County Dublin. and also to those smaller urban areas. I'm a councillor for Blanchardstown, and even over there we have people asking me if we can get the NIFTI service extended to Blanchardstown, Castleknock, so that people can access Connolly Hospital, Beaumont Hospital, can go to Ashburn or Skerries or Swords. So, I'd really like to see NIFTI becoming a fingal-wide, county-wide service.
Okay, Brendan Ryan, TD, you're a local representative here. Have you seen any impact of a service like NIFTI on local constituents?
Well, I think they're about to roll this out in terms of the service now from Skerries, and I think that's going to be really positive. As a public representative for the last 3 or 4 years, I've been trying to push Dublin Bus to provide a service directly from the constituency into Beaumont Hospital, but they point blankly refused to do it, on the basis that they were applying a different model of service, kind of radial rather than directly up to the hospital. So this is very positive. This is going to provide the solution that I was looking for, and it's fantastic to see it beginning its life today.
Yeah, and of course the size of bus, which we can see here behind us, it makes it much more flexible. They don't have to fill it with large numbers of people, and it can go places that the double-deckers, for instance, can't.
Well, this is absolutely it. I mean, right around the county here, you've got narrow roads, we've got low bridges, and I think the type of bus we have here will give the service the flexibility that's required. Additionally, the nature of it is it's response to demand, local demand, a phone call or whatever. It's not a fixed service, so the level of flexibility they talked about inside is going to be very important.
Okay. I'm joined now by Liam Duffy, Skerries resident and CEO of Beaumont Hospital. Liam, what kind of impact do you think a service like this is going to have on residents in Skerries and people who have to visit the hospital?
Well, as you know, the transport facilities to Beaumont are quite poor from the North Dublin region. And perhaps you might get to Beaumont quicker from Galway than you would from North Dublin or Fingal. So I think this facility is a fantastic opportunity for the patients and for the public. I think it's important that it's supported to end up being a viable service as well, so that it's one that's dependable and is frequent.
Do you see a service like this being a viable business model for hospitals in general?
I think in general, when you think about the hospital, it's actually a core of the community, and yet you've got to go to a circumvented way to get there. So looking at it from a business model, you can certainly ensure that people can get there and there's value in it. And I think particularly with volunteers running a service, there's obviously the cost of that is completely different than actually having a business model that's going to make money. Okay.
Minister James Reilly, it must be great for you to get out after such a long time in the Dáil, sort of late nights out in the sunshine, on what is actually a very joyous occasion here.
I think there's nothing better than the fine, fresh air of Fingal. And it's lovely to be here in Skerries. It's great to be here launching such a wonderful community initiative, something that's very close to my heart. As a GP who practiced in Lusk for 25 odd years, the fact that my patients had such difficulty accessing hospital services because of the poor transport arrangements, which still exist, although much improved, they have to go into town to come back out to town to get to Beaumont. It is our hospital of referral, so I think I'll allude to this as the beautiful Beaumont bus that brings all people in and out, and not just for patients going to outpatients, but also for friends and relatives going to see their loved ones in the hospital when they're not well. And many of them are older when they have to make these trips. So it's a fantastic service. It's one that I 100% support, and I'll be certainly doing everything I can at Cabinet to encourage my colleagues to make funding available to run the service.
Would you see scope for developing a service like this on a hospital hub basis? Every hospital having its own local bus service?
Well, absolutely. Given the fact that we now have hospital groups and that Beaumont and Blanchardstown and Drogheda are all together with, Cavan and Monaghan, I think this would be a wonderful idea and should be funded perhaps in a slightly different way, but we'll explore that. At the moment, I think the volunteerism of NIFTI and Stephanie and Eric Bentley and the great community support they're getting is wonderful. And I think I've always held the view, and I've said it many times all around the country, I'm always more inclined to support initiatives that have real community involvement in them as well, because they're the ones that are truly sustainable, and they're also the ones that the people obviously want because they're given of their own time in a volunteer way to deliver the service.
So we can look forward to more good news.
Absolutely.
Eric, congratulations on taking delivery of this fine new bus that I see driving out the gate there now. What does this mean for NIFTI?
Well, basically, it means we have a reliable bus in our fleet. The age of our fleet is getting slightly old now, so with the new bus replenishing it, not only gives us a more reliable bus to put on vital routes, but also frees up funding then from our repair and maintenance budget, so we can spend elsewhere improving services and keeping everything going with reduced funding.
I just didn't know what the noise was behind me, Tony. I thought you were changing tape. Okay. So where will that bus be used? What route will it be on?
That bus is specifically for the Swords to Beaumont Hospital service at the moment. As we were discussing today, we have applied for funding to extend that bus to start in Skerries, and that application is with the National Transport Authority at the moment.
I was looking at your website earlier, NIFTI.ie, and it strikes me that your service is very much tailored to the local community. I see you have a Tuesday night bus service to Swords for bingo and a similar service to Balbriggan. Have you any more interesting little services coming on?
Well, we do. We do a Friday night bingo to Balbriggan. We do senior citizens on a Monday from the Knoll, where we drive around and collect them, bring them to a community centre, and then drop them home again about 3 hours later. And we've actually started, instead of the community centre, we've started bringing them over to Avoca and Malahide Castle, because there's a nicer surroundings and the heating's already on. And we do a lot of stuff, like we look after Remember Us in Balbriggan 3 times a week, which is special needs children. We bring them down to a community centre or a play zone or whatever for 2 or 3 hours and then drop them home again.
That's terrific flexibility and a real reflection of your commitment to the community, and it's the kind of service that a national carrier like Iarn Road Éirden or CIE or Bus Éirden couldn't ever hope to do.
Yeah.
What's next for NIFTI?
Well, we do work closely with the Beaumont Hospital bus is in association with Bus Éirden, so you can get their bus from Balbriggan to Swords and then you get on our one. That's the initial setup for it, which is Minister Alan Kelly was calling for integrated services, and that's the first one that we could see that we could deliver immediately in Fingal. The Bus Éirden Dublin bus, they do their best with what they have and within the constraints that they have. I'm sure they'd be as flexible as us as they could be. But that's the point of the rural transport programme. We're in a zone where there is no public transport. There's particular demand for door-to-door, accessible transport, social inclusion, and that's where our brief is to operate. So we merely follow our brief and do our best.
Well, today's been a great day for you, so we'll literally get on and say goodbye to a few more people that I see waiting to talk to you.
Great. Thanks, Lorcan. Thank you.